The future of health with artificial intelligence is not an abstract promise or a vision designed for tech conferences. It is a set of practical changes that are already reshaping how we prevent, diagnose, and manage physical and mental conditions. The goal is not to replace doctors, therapists, or healthcare professionals, but to reduce errors, wasted time, inefficiencies, and decisions made with incomplete information. Health is a complex system, and AI is being used primarily to handle that complexity better than has ever been possible before. In physical health, the most visible shift is in early diagnosis.
Algorithms trained on massive clinical datasets can identify patterns that anticipate the onset of cardiovascular, metabolic, and neurological diseases with accuracy that often exceeds human averages, especially when signals are subtle or spread over time. This allows problems to be addressed before they become costly, disabling, or irreversible. This matters because a large portion of global healthcare spending is tied to late-stage management of chronic disease. AI does not eliminate illness, but it moves the point of intervention, and that is where the real impact lies. Another key area is treatment personalization. Many therapies today work statistically rather than precisely. Artificial intelligence makes it possible to combine genetics, lifestyle, drug response, and environmental data to suggest treatments better suited to each individual. This reduces side effects, increases effectiveness, and lowers the number of failed attempts.
In practical terms, this means fewer hospitalizations, fewer unnecessary medications, and less frustration for both patients and professionals. Pharmaceutical research is also changing its approach. Advanced simulations allow molecules to be tested virtually, filtering out ineffective or dangerous options early. Development timelines shorten and costs decrease, directly affecting access to care. Mental health is evolving differently, but just as concretely. AI is used to monitor behavioral and linguistic signals associated with psychological distress, not to produce automatic clinical diagnoses, but to detect trends and changes that often go unnoticed. Analyzing sleep patterns, interaction frequency, and written or spoken language can reveal early signs of stress, anxiety, or depression. This creates opportunities to intervene before conditions escalate. Accessibility is another major factor. Mental health services are often expensive or difficult to reach. AI-based tools can provide a first layer of support, guidance, and continuous monitoring, especially in areas where traditional care is limited.
They do not replace therapy, but they reduce the gap between need and intervention. Operationally, this leads to fewer emergencies and more continuity in care. Daily prevention is another area of transformation. Wearables and intelligent applications collect data on movement, nutrition, sleep, and stress, and convert it into practical recommendations. These are not generic tips, but suggestions adapted to real behavior. This shifts the focus from occasional decisions to consistent habits. Health becomes a matter of repeated micro-actions over time. Healthcare systems themselves are changing. AI is used to optimize workflows, reduce waiting times, predict demand spikes, and allocate resources more efficiently. This directly affects care quality and financial sustainability. Less waste means more capacity to invest in prevention and innovation. A less visible but critical shift involves data relationships. The future of health is data-driven, which brings new responsibilities for institutions and individuals alike. Ethical, secure, and transparent management of health information is essential. Without trust, these systems fail.
With the right safeguards, the benefits far outweigh the risks. A healthier future with AI is not a sudden revolution, but a gradual process of tools that improve decisions, reduce uncertainty, and make health more measurable and manageable. It does not make life perfect, but it makes it more predictable. And in healthcare, predictability is often the difference between timely action and arriving too late. This gradual process is also redefining people's roles within the health system. Individuals are no longer passive recipients of care, but active participants making informed decisions based on concrete data. AI reveals what was once intuitive or ignored, such as the real long-term impact of certain habits. Poor sleep is no longer just a feeling of fatigue, but a curve showing measurable consequences on focus, mood, and physical risk. Poor nutrition becomes a quantifiable link to inflammation, energy levels, and immune response. This continuous feedback changes behavior more effectively than traditional health campaigns. In the workplace, artificial intelligence is already influencing health, even if it is not always recognized as such. Systems that analyze cognitive load, schedules, breaks, and stress levels help redesign workflows to reduce chronic fatigue. This is not about abstract wellness, but about reducing errors, absenteeism, and healthcare costs. Companies adopt these tools because they are economically rational. Health becomes an efficiency variable. Cities are also part of this transformation.
AI is used to monitor air quality, noise, traffic, and access to healthcare services, with direct effects on public health. Reducing exposure to environmental risk factors prevents respiratory and cardiovascular disease and sleep disorders at scale. Here, the impact is collective rather than individual. Aging is another critical area. Populations are getting older, and traditional healthcare systems struggle to keep up. Artificial intelligence enables continuous monitoring of vulnerable individuals, detecting anomalies in movement, habits, or vital signs. This allows for timely intervention without immediate hospitalization, more autonomy, fewer emergencies. It is a pragmatic response to a structural challenge. The doctor-patient relationship is also evolving. With more data available, consultations rely less on memory and more on analysis. Time can be used more effectively, focusing on decisions rather than information gathering. This does not make the relationship colder, but more efficient.
The human element is not removed, it is freed from repetitive tasks. In mental health, AI is helping normalize the monitoring of emotional well-being. Just as checking blood pressure or heart rate has become routine, tracking mood and stress trends is becoming standard practice. This reduces stigma and lowers the barrier to seeking help before distress becomes severe. Continuity is key. Small signals observed over time are more valuable than isolated assessments. Health education is also changing. AI enables health information to be adapted to individual comprehension levels, contexts, and needs. This increases effectiveness and reduces misinformation. Knowing what to do, when to do it, and why to do it is essential to health. Access alone is not enough. Understanding matters. There are limits and risks. Poorly designed algorithms can amplify inequality or error. Incomplete or biased data leads to unreliable outcomes. Human oversight remains essential. AI works best when integrated into clear, regulated, and transparent systems. It is not a magic solution, but a tool, and outcomes depend on how it is used. Looking ahead, the most significant shift will be cultural rather than technological. Health will increasingly be seen as something to manage over time rather than something to recover only after loss. AI accelerates this transition by making the future more readable.
Knowing where we are headed allows course correction before the cost becomes too high. A healthier future with artificial intelligence does not mean eliminating illness or discomfort, but reducing unpredictability and improving response capacity. It is a future where decisions matter more because they are based on better information, and that alone represents a substantial step forward. This shift also affects how trust is built between people and the systems that support their health. As AI becomes more integrated into care, transparency around how recommendations are generated becomes part of the health experience itself.
Understanding why a certain action is suggested increases adherence and reduces resistance. When systems explain their reasoning in clear, usable terms, they become tools rather than authorities. This clarity changes how people engage with their own data, turning information into something actionable instead of overwhelming. Another emerging impact concerns crisis management. AI-driven early warning systems are increasingly used to anticipate outbreaks, hospital overloads, and supply shortages by analyzing trends across regions and populations. This allows responses to be organized before pressure peaks, reducing disruption and improving outcomes during emergencies.
It shifts healthcare from reactive coordination to proactive planning. Rehabilitation and recovery are also evolving. Adaptive systems can adjust physical or cognitive rehabilitation programs in real time based on performance and fatigue, making recovery more efficient and less discouraging. Progress is measured continuously rather than at fixed checkpoints, allowing small gains to accumulate more consistently. This personalization increases adherence and shortens recovery timelines. There is also a growing role for AI in supporting caregivers, both professional and informal. By monitoring routines and flagging deviations, these systems reduce cognitive load and decision fatigue for those responsible for others' well-being. This support lowers burnout and improves care quality without adding complexity.
Finally, as these technologies mature, they encourage a broader definition of health that includes stability, resilience, and functional capacity rather than the absence of disease alone. This reframing aligns health systems more closely with how people actually live, work, and age. In this context, artificial intelligence is not a distant innovation, but a practical infrastructure, quietly shaping decisions at scale and making health outcomes less dependent on chance and more on informed, timely action.